Hello, all. Welcome back to The Spark is Love. I'm Casey, and I have with me a beautiful, beautiful guest. Now, I am pulling all my nurses that I've known together and on my path to look forward to transforming healthcare and seeing a new healthcare system. I want to promote those who are working really hard in the background. And with me, I have Leanne Meier. Now, she's not like me. She's been working on this for a long time. She has realized how broken the system is, and she really went into action. So she's actually the host of a podcast called Once a Nurse, Always a Nurse. And I'm going to leave the link in the description if you want to visit her channel. She has really, really good stuff. But before I talk my head off, I'm just gonna welcome Leanne and welcome to our show. And I just wanted to. How long have you been a nurse? I just wanted to introduce you.
Casey, thank you so much for welcoming me to this show. You and I were able to talk previously, and I feel like we're already friends. So thank you. I appreciate it. How long have I been a nurse? Was
Yes,
that the
ma'am.
question? I believe I started nursing 51 years ago, and I graduated about 48 years ago. So yeah, so long time.
Yes, lots of experience. Now, what moved you to do a podcast?
That's a really interesting story. Yeah, I was teaching a nurse refresher course. So nurses who have left nursing and then want to come back, if they've been gone longer than 5 years, at that time they had to do this refresher course. And I, in fact, had accidentally lost my license through trying to renew online and screwed it up. And so I ended up having to take this course myself. And then a couple of years later, they called and said, would you like to teach the course? And I spent an hour trying to convince them that no way in hell was I a good person to be teaching this class, and then
Yeah.
ended up talking myself into doing it. So I did it for 5 years and I absolutely loved it. And it almost killed me to have to leave.
Oh,
So in the course of doing that, one of my students who was a public PhD, yeah, PhD nurse, and she was going to be starting to write books and do different things that she wanted to use the RN, which she hadn't kept up. So she was in the class and she came up to me and she said, Leanne, you have got to get this information out further than just these few people in the classroom. And so I thought, oh, that's an interesting idea. And the next day I was taking a nap and I got a cold call from a company called voiceamerica.com. And they wanted to know if I'd be interested in doing, excuse me, an international talk show for nurses once a week live. Well, I knew nothing about podcasts or technology or anything. I was absolutely terrified. But after about a year, I got a new producer who got me on the air in about 3 weeks. And that was in 2017, the end of July. And so I've done over 150, maybe 160 some shows. Way lost count a long time ago. But what I realized was that in the course of talking to nurses, I realized how deep my passion for nurses is and for what nurses do, and the realization that people in the community really have no idea what nurses do. Um, and I think that the healing that does happen in hospitals comes because to a great degree of what nurses do.
I agree
So
with
that
you.
was a long answer to a short question.
No, but it's fascinating. It's fascinating because you started this in 2017. When you started, I don't think you foresee what was going to happen with this pandemic,
Not at all.
but your content is so relevant. Your content spans on nurse burnout, self-care techniques, what's going on in nursing, the latest. It came at the right time. And you know what when you look at the condition right now of nurses, now this is 2021. And our nurses have been on the front lines in this pandemic. And a lot of people are talking about nurses leaving, retention. What are your thoughts on this
Oh
situation?
boy, I tell you, when 2020 hit and I realized pretty quickly what was going to happen to nurses, because I knew this was not going to be a quick fix and that it was going to be nurses that we would be on the brunt of it. And so I was walking the floors at night for months thinking, what can I do? How can I make this better for them? Um, I had never had an experience like COVID, but I'd had enough experiences to know exactly what they were experiencing and having to deal with. Um, so my feeling initially was I wanted to support nurses to be able to do it, to support themselves, take care of themselves. Almost immediately, like in June of 2020, I wanted to have something out there that would be psychological support, someone to talk to in the middle of the night. So 24/7, 365. And I had no clue how to make something like that happen. So I spent about 6 months asking everybody I knew, how could this happen? Do you know how to do this? And then I ran into a young nurse by the name of Melissa Cortez. And it turned out that she had already done what I wanted to do. So I immediately called her and said, can I, be the fly on your tail, your horse's tail, and just go along with you? And so we made a connection that way. And within a short time after that, I started realizing we need to change healthcare. And, it's just such a huge monster elephant, bigger than an elephant. And nobody has really known, where do you start? Because it's like a house of cards. You pull one card, the whole thing goes down. And COVID took the whole thing down. And so now we have a choice of building it back the way it was, or building it back the way we want it. And I started thinking, who are the people most able to really do this building in a healthy way, in a way that's going to make our country a healthier place to be and a happier place to be. And I thought, there's so much money involved already that those people who are making tremendous amounts of money, and I include the doctors in this too, it's sort of a internal corruption that to give up that huge amount of money to go to a more reasonable level, so that you can focus on and take time with patients and truly help them become healthy and stay healthy. So very important. I felt like nurses were not a part of that corruption yet, because we have just been on salary or hourly wage. We're a line item on a budget in a hospital, and other than those who have gone and done entrepreneurial things, for the most part, nurses are still looking at, what can I do to create more health in the patients I see? So
Yeah.
they were my number one. I thought, that's it. Nurses have to do it. So we created Nurses Transforming Healthcare. And it's not history yet. We're still in the very beginning stages, but we are definitely making progress.
Yes, and this is really wonderful to hear. I had the privilege of interviewing Dr. John Silver, and he is on your team, and he
He
kind of
is.
was, his model. And so, if you haven't seen it, be sure to look at our video interviewing with him. But I really love his model. But you mentioned something. You mentioned about the money and the decisions. We're kind of in a place in humanity where morality is kind of off the chain, and doing the right thing is not as easy as it seems. But our combination here, Leanne, you've been a nurse. I'm a baby nurse compared to you. I've been a nurse for a little over 10 years. You've been a nurse for almost half of a century, if not over. And
It's kind of scary to think about.
The reason why I'm saying this is because for a long time, nurses had a culture. Well, it was said that in the nursing culture that nurses eat their own, but something phenomenal is actually happening, and I'm so excited to document this because we have experienced nurses such as yourself, and you could easily say, "Well, I did my time. I'm retired," but you guys are coming back to help us. And so now, as the younger generation of nursing and the nurses who are in the students who are in nursing school, now we have to figure out how do we help ourselves to change this culture? Because there's this culture where I don't know if you can let me know if you agree with me, but within nursing, we have this culture, most of us, we care so much about people that sometimes we forget to take care of ourselves. And on this drive in the middle of a pandemic where you have so many needs, so many nurses are, it's not just about the money that they're being offered, but they're realizing if I don't go, who will? So where does self-care fit into all of that? And for you being a nurse for such a long time and even wanting to come back in the game and help us, um, for you have survived, so you must know what it means to take care of yourself and
Mm,
take care of your patients. So that's kind of a loaded question, but can you
mhm.
share some insights, some of your insights?
Yeah, the reality is partly, I think, because of our training as women, to be so caring and selfless. That also comes into the nursing profession because so many, 80+% of nurses are still women. And many times I see that the men that are attracted to nursing have a lot of those characteristics of, relational importance and, really wanting to help other people in a considerable way. And, certainly people come into nursing and healthcare for other reasons too. But those still, when you count in all people in healthcare, something around 85% have that personality of sensing and what's the other one? Um, Thinking and feeling. So sensing and feeling. And that combination means that we want to do whatever it is that's needed to be able to have a positive outcome for that person. So our focus tends to be a little less on ourselves. So I think when you're in the trenches, and I think that warfare kind of concept, metaphor is perfect because that is how it feels, that you're all alone on a shift with whoever you're working with, whatever is coming up, it's you that will have to deal with it. So it's that kind of a mindset and, being able to go to the bathroom, being able to get something to eat, all of those things. We pride ourselves on not taking care of ourselves in those ways that, I can go 16 hours without going to the bathroom. It's not good. But yet, because we don't know how else to change it, we have taken it as a personal pride. And that has not helped us. I did all the wrong things. I damaged myself almost, well, to the point of being disabled. And doctors told me for 20 years that I had to get out of nursing and that I had to stop doing what I was doing, which was putting myself out in order to help the patient. I just worked hurt and I got more and more and more hurt. And I finally got to the point where I literally was disabled. I had to go on disability. That was a crushing blow. I wanted to be at the bedside for my entire career. But in the course of doing that, I started to learn that the mindset I had and the perceptions I had about what was required of me or um, uh, expected of me were not healthy and would not be sustaining over a lifetime. So it took me years to of lots of different things, psychological assistance, physical training, and help with chiropractors and any number of doctors and all kinds of different things to try and help. And I am finally now, in the last probably 2 years, knock on wood, the best that I've been for most of my adult life. I lived most of my life in pain almost all the time. And so because now in the last year, I've started focusing on food, anti-inflammatory food, just all of the different things, getting enough sleep. And COVID has kind of helped in that because we had to stay home. We couldn't go running around and, wearing ourselves to death. So those things were kind of helpful, but it also helped me to watch what was happening with the nurses out there and talking to nurses, hearing their stories, hearing what they were doing, and many of them not even realizing that what was happening to them was abuse. They were getting PTSD, or what many people who are in the nursing field are calling it more moral suffering. You talked about the culture that we're in, where we have things really upside down on what we need to be doing. And what that's causing is suicidal thoughts through suicidal behavior. The studies that have been done have all been done on doctors. I've noticed there's been a couple of newer studies on nurses, particularly because of COVID. But for the most part, those studies weren't being done. And some of the more recent things that I've seen shows that nurses have more of that suicidal intention or thought process. And more nurses are moving toward committing suicide. So while doctors are doing that, when you really look at why, it's because we're not meeting the moral code that brought us into nursing, the true desire to help. When we look at our patients, I hear a lot of ICU nurses saying, I look at my patients and every single one of those diseases they're in with could have been prevented. And why weren't they?
Yeah.
And when you talk to doctors, as they got into a place where they didn't have as much control over their own clinics, had to spend, 5 to 10 minutes with each patient, which usually ends up, okay, you got a stomach ache, here's the prescription, see you around. And that was not satisfactory to especially doctors who came into the profession to know their patients, to care about their patients, to hear the whole picture of the patients and even the family and how that interacts and impacts that person's health. And so I think that's where we need to go, is we need to go back to the basics of what is the healthcare field about? What is that moral code that we've been pushing aside? We need to bring it back front and center. And that's what I want to be a part of.
I think you already are on your way there. You're heading there with Nurses Transforming Healthcare. I thank you for sharing your story, because what I hope to create is awareness, not just for nurses, but even for the community, for them to know what it's like. I've seen on social media what some very disparaging remarks like, just do your job, and they don't realize that us doing our job even before the pandemic was us making it happen with very, very limited resources to care for ourselves.
Exactly.
So after
Or
pandemic,
even to care for our patients.
exactly.
When you are running around spending time looking for supplies, when you are calling people to find out where is that medication, when you are running after, some instrument that didn't get, sterilized quickly enough and you need it now, the nurses are the ones that often end up doing those things. So we don't have time to do the things we are supposed to be doing. And we have way too many patients to be able to do the best kind of care with each patient. So it keeps hurting our soul.
Yes, and you wrote that you wrote that you are committed in changing the model from disease care to actual health care.
Yes.
That's a a lot of people say, well, so much money is already being spent on healthcare, but the population is not healthy. What would you say to that?
Correct. We could take all day on that, but I will keep it to a shorter answer. The reality is that as businesses found out how profitable that healthcare could be, everything focused on how do we get more money for every single thing that we do. And so rather than looking out for what's best for the patient, we've gone much more to more of a specialist kind of format, so that one, you can charge more for the things that you do because you're a specialist. But then you lose the primary care of who is that doctor who really knows all about you, who really is following. Okay, you've got this problem, and I suggested you go to this specialist, but that didn't find us anything. But what did we learn from that? And who am I going to, interact with next? Are we completely on the wrong track if we're looking at the medical side of it? Maybe this is a psychological, emotional, or spiritual thing. So that person who looks at the whole picture is the person who gets paid the least. And that happens with nurses, but that also happens with primary doctors. And so what you have again is that moral harm to the person who truly wants to do what's best for their patient, but have to, in order to make a living, they have to keep in the back of their mind, how many tests am I ordering? I will, it's probably in my benefit to order more tests than I actually need, because, even if they don't come out telling us anything, that at least either covers me if, somewhere down the line, somebody says, well, why didn't you do a CAT scan? Why didn't you do this? But we know that we're not going to learn anything from that test that's really going to help us with this person. So the costs go up, but we really don't get to a place because we're not dealing with the basic health. And along with that is, I think, by having all these people who want to write a prescription, we have gotten into the mindset as citizens of our country that we are not responsible for our own health, that is the responsibility of people out there. So we don't necessarily hold to task who are those people who are making our food, and how are they making our food. What are we doing as far as exercise? It used to be people worked on farms. 75% of people in the United States were farm or farm related. You were working hard all day long. You could eat foods that were full of fat. In fact, you needed to have it to be able to, keep going for a whole day. But you worked those things off. Not entirely. There were still plenty of people that died young, in their 60s. I remember thinking 70 was ancient. And now, as my mother is approaching 94, I just think, how is this possible? It's because of all the ways that we can keep people going, but still not getting at the aspect of what is making me healthy. And
Mhm.
how do I take responsibility for that? And I'm the worst one. I have fought this, taking care of my own self, for years. And it's really only about in March of this year that I started saying, okay, I give up. I'm in, pain. I need to change this. And what do I have to do? Well, I found out I had to change almost everything I was doing, including eating, in
Wow.
order to get better. And, the change has been helpful.
I would tell you this. I love what Michael Jackson say. He say, if you want to make a change, start with the man in the mirror. So I am taking this step, and I'm going to get passionate about this because people might say, well, I'm watching this and I'm not even a nurse. So why should I even care about nurses changing healthcare? Like, I don't care. Just somebody take care of me. But this topic, this conversation impacts everyone, every single person. People are not healthy. We are not healthy as a population. And we
Mhm.
need to realize that healthcare is important if we want to survive.
Oh,
So
yes.
many people are pursuing wealth, but health is your wealth. You cannot be wealthy,
Yeah.
or you can, but you're not going to enjoy it. You're not going to
Yeah.
enjoy it. But you mentioned something very important. You talked about the businesses getting into healthcare, and
Mhm.
it can be profitable. But just my thoughts is, not just in nursing, but throughout the United States, a lot of people are leaving their jobs. And something that went through my mind is, what if people are realizing that their job is not only is it not fulfilling their personal purpose, but in the grand scheme of things, they're just pushing a product for a profit. They're not actually impacting lives.
Mhm.
And I think sometimes when things happen and we don't want it to happen, we could think, oh no, this is terrible. But sometimes it's a wake up call.
Yes.
It's a wake up call to say, well, am I really truly aligned with,
Mhm.
if I died today, the thing that I'm doing, the career or the job that I'm pursuing, did it really help lives? Did it really help people not just to live, but to not just to exist,
To
but to live a
thrive.
fulfilling, yes,
Yes.
thrive. And even as a nurse, I had to ask myself, like, I love bedside nursing, I really do, but I had to stop and think. I spent most of my life helping people to avoid dying, and I have
Yes.
all the tools to actually help them to live. And
Yes.
I wasn't living and I was not helping them to live. We were just afraid of dying. And
Yep.
a bit
And
passionate, sorry.
no, no, no. Nurses are part of a system where we're kind of pretty far down on the totem pole because our culture has moved so much. I mean, it's always been, if you read history, wealth and the pursuit of wealth has always been there as long as there's been human beings, it seems. But nurses have not been seen as being very valuable because, and actually you can extend that. Look at teachers. Who is more valuable than teachers? Mothers. Starting that person out, raising them, encouraging them, getting them good healthy habits in their early years to continue on in life. All those things, the people who are doing the most important jobs for the future of the world are the people who are either not getting paid or getting paid very little. So what ends up happening is that we start to buy into, okay, well, we think this is how it should happen, but clearly, the market is not moving in that direction. So that means we have to go with that idea of more wealth is going to be more happiness. I don't know if you followed any of the research studies about who are the happiest people in the world. Have you heard any recently?
Not recently.
Almost every single study for the last probably 30 or 40 years that I've been paying attention, the happiest people in the world are volunteers.
I would see that. I can see that very
Yes, yes. And
easily.
people who are really, doing for others who cannot give them anything back. And that is something we need to come back to because that is truly the crucial thing. That's why doctors are no longer satisfied. All of the things that we're doing do not push our emotional, mental, spiritual, moral code forward. They hinder us. And then we become ill ourselves, mentally, physically. We can't do the work we really truly want to do. Many of us, even who feel like we want to come home and maybe, do something with our church or with our neighborhood or in our schools or whatever it is that we thought we would like to do. We're so exhausted when we get home. We can barely get something to eat, get some sleep, and go right back in and do it again. So we have to change it because clearly nobody else is going to. And part of all that money stuff is that, yeah, these hospital systems are making money, but the money is not going back into the people who really make the money for them. And, really, you could think of nurses as the product that these huge hospital chains are selling. Because if you don't have a good experience with the nurse at your bedside, you're probably not coming back. Even if your doctor is somebody you like, you may ask them, where else could I go, that you go to. But, if you did not have a good experience with that nurse, it has a profound effect on your opinion of that hospital.
Yes, that is very true. That is very true. And so, as a nurse, and we're not at the bedside, but we are encouraging and motivating, inspiring nurses who are in the front lines to really take care of themselves. But just for everyone, just to pull back and really find alignment with what they're doing and who they are, and is it really leading you to a happy, healthy life? Because even, and I had this conversation, there are so many factors to change in the healthcare. The system is broken, but
Yes,
also our mindset is broken, both the caregiver and the receiver.
right. And the structure, I mean, a lot of people are talking now. It's like, everybody's sort of waking up and going, oh my goodness, look what COVID showed. Well,
Yes.
COVID did not cause the problems that we have here, it just revealed them. And so that's really what we have to look at if we're really looking at what is the true cause here and what are the things that that are delivering this bad effect. I don't know if you've heard this, but in the last couple of weeks I heard that of the 11 largest industrial countries in the world, when you look at their health outcomes, the United States is 11th. And if you look at the 37th highest or largest industrial countries in the world, we are 37th.
Wow.
And we don't know that. People in the United States think that we have the best healthcare system in the world. And we have the best disease care system in the world. If you have a really bad disease, come to the United States and boy, oh boy, can we do a lot with it, but you will pay through the nose for it.
Yes.
So is that really helpful? Because if we have healthy people from birth to grave, those people feel good. Those people want to go out and use their abilities and their talents, whether that's at a job or in art or helping other people or whatever it is. They want to do something, and by doing that, they probably are working, they probably are making money, they can pay taxes, they can contribute in so many different ways. And we get input from perspectives of people from all different walks of life. And all of those perspectives come together and help us be the great nation that we have been because of all the immigrants that we welcome into our country. It's not in spite of it, it's because of it.
Leanne, it's so amazing. And we can talk about healthcare for a long time. But one thing I really like about this constructive conversation, it is you when you think about like you were talking about industrial countries in our society, in our civilization, the wealth of a country is based on the GDP. So how much the country produces.
Right.
When you look at high producing jobs, when you look at the tech industry, when you look at things like Google, Amazon, PayPal, if you look at their company benefits, you would see number one is healthcare. They provide really good healthcare. Um, the culture is healthy. They want their people to be healthy. And I just think what we're talking about. It's not just for the rich. It's not just for the billionaire businesses. Every business owner, every person, every family head, they should be really interested in the health of who's on their team. Whoever is on their team, they need to be if they want to produce. You cannot produce if you are not healthy. You cannot be a function optimum. You may do wonderful things, but you cannot be optimum functioning human being if you're not healthy. And as nurses, I think this is something we see firsthand and we really need to advocate for. But instead of like not just them, you need to be healthy, like we need to be healthy. This is
Mhm.
why speaking out, because we're speaking out because we want to be healthy so we can give you our best, so you can do your best to service the world. I don't know if that makes sense.
Yeah, it's funny because those people who are there, they see their job is to make more money for their company. They recognize that it's sort of the theory of it, but not the practice. So these huge companies are buying healthcare, but they're buying it from the market of healthcare in the United States, which is a disease care system. So they're paying a lot of money to keep their employees healthy, but their employees are not healthy, and then they lose them because they're sick or in the hospital, have cancer, or whatever the other things are. The other thing is they may have them on a healthcare plan, but they're not giving them PTO and sick time to be able to be home and get well. They don't seem to see the connection between you cannot work somebody every day, that you will wear them down mentally, emotionally, physically, spiritually. They cannot keep going even if they want to. And that seems to be more and more of what we're trying to do is how do we get more for less out of our employees? And I think that's why so many people are leaving, not just healthcare, but those quote unquote essential jobs where maybe previously people weren't thinking of themselves as essential, and so yeah, I'm making minimum wage, and yeah, I don't have much in the way of benefits, and yeah, I have to work 3 jobs to keep my family going, but I'm doing not very important work. Well, all of a sudden, being a truck driver and being able to stack the shelves with food became an essential aspect of work. However, we're still not going to give you any protection from the COVID that the rest of us are hiding from. We're not going to give you any increased pay for being on the battle lines. We're not going to do anything more than pat you on the head and give you lip service. So this is not health. And people don't get that.
Yes. So I feel as though nurses transform in healthcare is even just the first of all defining what health is for the population, knowing what healthy means,
Mhm.
and really educating the population as to what healthy is, and also really trying to restructure the systems behind the current healthcare or disease care model.
Right.
And I go
And
ahead.
again, rather than systems, what we need to look at is the structure, because systems kind of indicate more maybe policies or procedures on different things, or who is involved in doing what. But the structure of it is so corrupted that the structure is all geared only toward making more and more and more money. And it is, and like you said, keeping people alive a little bit longer, which means the greatest majority of healthcare dollars are spent in the last few months to years of any human person's life. So you may be keeping them alive to 94 or 100 or 105 or whatever, but what kind of life do they have? And that's what we're not paying attention to. Um, we've got a lot of work to do in re-educating, and it's especially our own people. Healthcare people need to re-educate themselves that what we have come to think is normal may be familiar and common. It's not normal. And
Yeah.
it's even spread around the world. So there are, other countries that, are trying in many ways, at least have universal health, but in many ways, their population is not, a tremendous amount healthier than we are. And part of that is because of food, because of, lack of exercise and some of the other things that we tend to just kind of push aside.
Very true, very true. And you know, I think what we're doing here is creating awareness. So if you're joining us and you are in healthcare or you know someone who is in healthcare, you know, please send them the link, nursestransforminthealthcare.org. It's going to be in the description box. And you know, encourage them to listen to Once a Nurse, Always a Nurse by Leanne Meier. And, you know, stay tuned. We want to talk about solutions. We want to talk about, well, if you are in a situation where you're not aligned, how you cannot feel stuck, how you cannot feel like there is no other option but to stay here until I burn out. There's a lot of resources for you. So please stay tuned. Thank you so much, Leanne. Did you have any
You're
final
so
words?
welcome. I was just going to read a paragraph from Kim Evans' book, which is kind of where we got the idea. It's Transforming Healthcare, Healing You, Me, and Our Broken Disease Care System. She's an APRN who was an ICU nurse and realized that every one of her patients' problems could have been prevented. And so she's now had her own nurse-led clinic with nurses running the clinic for 25 years. And so she said, our healthcare system is broken. In fact, we do not have healthcare in this country. We have disease care. We wait until you get sick and then we try to fix you. Yet we can truly transform healthcare. Sooner or later, each of us will interact with our healthcare system, whether for our families or ourselves. Let's create a system that we can each be proud of and that we would feel confident and comforted to take our loved ones to. Let's transform our broken disease care system into a model of true caring and compassion, focused on health, wellness, and disease prevention. Let's
Sounds
do it. Nurses can
like
do it.
we can do it. Sounds like my kind of lady. So thank you so much, Leanne, for joining us today. We enjoyed this conversation. Please check out her podcast. And if you have comments or questions, please be sure to leave it in the comments box below. Thank you so much for joining, and I look forward to seeing you next time.